So in terms of, reducing that, exercise is one part. But apart of that, what specific dietary habits one should inculcate in order to, reduce the visceral fat?
Ideally, you should take what is known as the Mediterranean diet. The Mediterranean diet is one which is very good in green vegetables, in fruits, in unsaturated oils, less of dairy, and more of lean meat. By lean meat, I mean fish, I mean chicken, white meat, stuff like that. So if you have the Mediterranean diet, that's the best possible diet to have, which would definitely reduce your visceral fat. That's why dietary modifications are done.
And what about, vegetarians?
See, the biggest problem with vegetarians is that intrinsically in the vegetarian diet, there's hardly any vitamin D or B complex. B12 can only come from non-vegetarian sources: egg yolks, meat, poultry, milk. Now, some people don't even take milk and milk products, so they are going to be very deficient. And I've primarily seen a lot of B12 deficiency in vegetarians, where you have to supplement it.
In this population, we saw many employees, they are having medium or high cholesterol levels in the body.
Mm.
And apart from the diet, what are some simple steps? I think exercises is the one. Apart of this, any type of stress or any type of, it can be a concurrence of any type of chronic ailment, as you see in the current, young population. Why such, it is occurring recurring in the young population as well?
You see, you are going to get, because of the unhealthy habits, most of the food is processed food. And this emphasis that we are now having on millets and on, having bajra, etc. in the diet is extremely important. But you need somebody who can make these things properly. Most of these companies now, you see, they are making bajra popcorn, etc., which makes a huge difference. But if you remember, way back perhaps at your mother's time, or when we were children, we used to have such stuff, which unfortunately got wiped out because of the processed foods. Now what do you have? You have burgers, you have pizzas, which is all processed food.
Speaking about, heart ailments. So basically there is a myth. So what is the basic difference between a heart attack and a heart failure?
When you talk of a heart attack, you basically mean that part of the muscle of the heart is dead. That means there's a clot in the arteries of the blood, and part of the muscle of the heart gets damaged. That's a heart attack. Heart failure is when the pumping of the heart suffers. It's not pumping adequately. The normal pumping of the heart is to the extent of 60 to 75%. 60 to 70%. Anything less than that, at 50, 40, 30, is heart failure.
So what activity is required? See, in office hours, it is very, very difficult to spare some time to go for a gym, or if there is anything in terms of ergonomics or in terms of any physical exercise which everybody can incorporate into their lifestyle. So what exactly one can do?
So I think what you could use certain tricks. For example, instead of using the lift, go down the stairs. That's the simplest solution. The moment you do that, you increase your activity to a great extent. Try and get up from your chair every hour. Take a few steps, walk a little. Don't continue sitting in your chair. That is important. Take time off the screen. Don't look at your screens all the time. Take your mind off it. Take a look outside the window. That is what is important.
So in terms of if we go for the blood test and blood checkups, so whether TGL, triglyceride or LDL, which one is the indicative factor?
When I look at a patient's lipid profile, I look at the total cholesterol and the HDL. Look at the cholesterol HDL ratio. I look at the LDL, or what we call the non-HDL. Higher the non-HDL, more the risk the patient has. Triglycerides also now recognized as part of the bad fat, so that also needs to be controlled.
So I think, in terms of, when we analyze the triglyceride levels, can it be a repercussion of the uncontrolled diabetes also?
Oh yes, when you have the first thing when I see very high triglyceride level is whether the patient has blood sugar. If he has a high blood sugar, invariably he's going to have high triglycerides. In fact, the sine qua non of any diabetics treatment is, when you're treating a patient of diabetes for his cholesterol, don't control the triglycerides immediately. Control the sugar. With that, his triglycerides will come down. If it doesn't come down, then you give medication specifically for the triglycerides.
And how relevant is the coronary artery calcium score test?
If done in a proper setting in a proper manner, it's quite reliable.
In terms of, can you just explain about it? What indications it happens? It is
Coronary calcium scoring is what you call a coronary CT angiography. What is the angiography? Is where you study the vasculature or the arteries which supply blood to the heart. Those are known as coronary arteries. You can do it two ways. You can do it the invasive way, where we put a small catheter into the heart arteries, inject dye, and take a picture, of which we inject the dye in the vein, and we put it into a CT scan machine, and with some very fancy algorithms and software, we can picture the arteries of the heart. Initially, the CT angiography was not really up to the mark, but now it's definitely up to the mark, especially with the very fast scanners that we have. Then that is where calcium coronary scoring comes in, where you look at how much calcium is deposited in the patient's coronary arteries.
We also found out, there were certain thyroid problems also, which were prevalent amongst the employees. What could have been the positive factors, do you believe? Because we see the age group was between 31 to 50.
You see, this problem occurred even earlier, and that was because of a lack of iodine, right? That is why the government of India way back decided that you need to iodize the salt. So most of your salt is now iodized. So the deficiency of iodine is now removed. Unfortunately, in women, you have a lot of autoimmune thyroiditis, where there is a destruction of the thyroid. And a lot of women have what we call hypothyroidism or a low thyroid, especially as you grow older. So beyond the age of 50, 60, almost 50 to 60% of women develop hypothyroidism. It's not so common in men.
Can it be connected to the PMS syndrome?
Not really, but definitely it's connected to the patient's hormones, to the women's hormones.
So while going to the post-menopausal phase?
Yes, when you're post-menopausal, it's essential that you look at your thyroid annually.
And sometimes what I have seen is that, as we also saw in the current report as well, women were more effective for anemia. So hemoglobin levels will come in comparison to male. And again, I think, it is a flag thing which we found out. What could have been the reason? Because young population was also there, young females were also affected.
Well, if you're looking at young females who are getting anemia, one of the commonest things that occurs in them is the menstrual cycle. If they have a heavy menstrual cycle, they are prone to getting iron deficiency anemia. Second, if it is a vegetarian, it is B12 deficiency, which could be contributing to it. Third is you could be having a parasitic infection, worms, etc., in the intestine, which would also make you get anemia.